Good morning, friends. I am Dr. Prathmesh Jain and I am a arthroscopy surgeon and I specialize in doing ligament injuries of the knee. We do a lot of ACL and other ligament surgeries of the knee. We are at presently doing around 500 ligament surgeries of the knee in a year. I want to share a very important observation with you. So when I saw my own patients, some of my patients were doing excellent and some of the patients were doing good to very good. And so I was always confused that what are the factors which govern the results of the patients, because we have done an identical surgeries on all the patients and some patients are doing exceptionally well, they are participating in their sports, getting back to their pre-injury levels, and some patients are doing good but they are not able to achieve that much of a result. So I just saw my patient and saw my own follow-up patients and we did a small study and they were very striking findings which we can make out. The very important findings that I could make out was that those patients who are in a supervision of a physiotherapist and those patients who are doing exercise which is supervised under a qualified physiotherapist are doing exceptionally well, and there is a very high chances that those kids are back to their sports and back to their pre-injury level. Also, we have found that the chances of knee stiffness or arthrofibrosis is very less in those patients who are in supervision of a qualified physiotherapist. So friends, a qualified physiotherapist and a physiotherapy under a qualified physiotherapist increases the success of the surgery to manifold, and I recommend all my patients and all the public in general to definitely follow a stringent physiotherapy protocol under a qualified physiotherapist, and that will definitely improve your results. Now people ask me, what is the cause of it? Why is it so? So there are many causes. The reason is a surgeon, an operating surgeon, because of his schedule, may not be able to schedule a very frequent follow-up visit with the patient. Whereas a physiotherapist can see a patient on a daily basis, he can see the recovery, see the improvement, and he can guide the patient properly. A physiotherapist has a very good knowledge of the anatomy and the procedure and the surgery that we do, and he is keenly involved with the patient acutely and on a daily basis. So, because of a personal touch, the recovery is better, the muscle building is better. What we have seen is there is a striking difference in the muscle bulk. So, if a patient is under the supervision of a physiotherapist, the muscle bulk and the quadriceps atrophy is much less. So that means they have a less atrophy and a good muscle power or muscle bulk which they come up when they come with the follow. The other reason is they are also very well versed with use of some specific modalities like interferential therapy, like shortwave diathermy, and like different types of laser, which an orthopedic surgeon do not have a exposure. Also, they are very tuned up into looking into range of motion and the recovery parameters, which an orthopedic surgeon may not be able to assess on a daily basis. So, supervised physiotherapy in which a patient is going daily with a physiotherapist in a short-term follow-up after the procedure is immensely helpful to the patient. I usually give this example that there are always good players, but good players cannot succeed without a good coach. So like you see, Saina Nehwal, PV Sindhu are good players, but unless they got a coach like Prakash Padukone, they are not able to achieve to that level of activity which they are supposed to. Similarly, sports specific training and sports specific activities is possible only under a qualified guidance. So if you want to achieve an excellent result with the surgery and So in those cases, I strongly recommend you to join a physiotherapy under a qualified physiotherapist for a long term to achieve the best results. I have seen my patients going back to sports, going back to their pre-injury level and playing even more better than they were playing before the injury. And that is usually possible by a close approach between the operating surgeon, the physiotherapist and the patients. These are the three gold stones of a successful outcome of a particular sports injury. I would be able to assist you if you need any help regarding this issue. You can ping me on the comment box. Thank you.